So, good afternoon. A very good afternoon to all the eminent doctors. Thank you so much for joining us for the today's webinar. Our endeavor is the spread the awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an initiative from Kedla through its innovation to serve the society and humankind. The topic of the webinar is dose reduction strategy in rabies management, role of novel vaccine. Dear doctor, rabies is the world's first 3-dose novel anti-rabies vaccine. With great pride, we would like to inform you that rabies has successfully completed 1 year of launch with more than 40 animal-wide victims being vaccinated. 100% compliance was recorded and no case of ADR was registered. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. Surendra Bapat sir, MBBS MS, gastroenterologist and cancer specialist and owner of Bapat Hospital. I would like to request Dr. Surendra Bapat sir to initiate the talk, and later on we will have two question answer session. All the participants can drop their questions in the drop box and we will read out all the questions after the presentation. Thank you, sir. Over to Surendra sir.
Okay, hello, good afternoon, everybody. I'm Dr. Surendra Bapat. We are going to talk on rabies and the new vaccine, which is rabies. So, rabies is a disease caused by a neurotropic virus of the species Lysa, and it is transmitted through the saliva of infected animals. The animals are mammals only. No other species except mammals can transmit the disease. Dog is the most common carrier, and other causative animals can be raccoons, cats, mice, and wild animals like jackals, wolves, etc. Even bats. The history is very old. It is one of the oldest diseases reported in history, 2300 BC. And the word is derived from the Latin word rabere, which means rage, rave, or madness. It's also said to be derived from the Sanskrit word rabhas, which means violence. So the patient becomes very violent and very aggressive, and that's why the disease is called rabies. The symptoms are fever, cramps, body ache, and excessive salivation. So the most common symptom is excessive salivation and a fear of any food or any water, even water. That's why it is also known as hydrophobia. The patient gets so violent even by seeing the water or food because it's not able to swallow it because of the spasm of the neck muscles. And that's why the name hydrophobia is also in common practice. Now we come to the slides. There are 3 novel doses of G protein vaccines, ultimately for the treatment of rabies. Next slide. Globally, 59,000 human deaths are reported annually, highest in India. About 35% of the total deaths in the world are caused by rabies in India. 20,000 human deaths from rabies, accounting 60% for the Asian deaths and 35% for the global deaths. 91% of the deaths occur in the rural areas because animals are more prevalent in the rural areas. The treatment, what is the management of rabies? So there are 3 lines of treatment. One is the local management of the wound. The wound should be thoroughly washed either with soap and water or with Savlon or betadine or anything that you have. And the wound should usually be dressed lightly, not compressed very hard. It should be, usually it is not stitched. The wound usually is not stitched. Then the second line of treatment is active immunization, which is the vaccine. In initial days, the vaccines were given on the abdominal wall and there were 16 injections, 14 injections, and now they have come down to 5 injections. And now again, rabies has come down to 3 injections. And the third treatment is passive immunization, that is immunoglobulins, to be given when the disease chances are very high. Current rabies vaccines are called cell culture vaccines. They are inconsistency in potency, stability is questionable, availability is usually in short supply, and they cause more adverse effects because of the protein. Compliance of rabies vaccine is very low, usually because the full course of vaccine requires at least 5 doses. So most of the patients don't get the 5 doses. Some storage problems are there, some distance from the hospital is there. Compliance is poor for the 5 doses. Non-compliance of 5 doses, this is given in this chart, which I have already told you. There are various reasons: distance from the hospital, availability of transport, cost effectiveness, the cost of the treatment. Then it is a prolonged period. It takes around 45 days for the 5 doses. So the patients fall off. This is the study done at Safdarjung Hospital, New Delhi on 360 animal bite patients. And 53% were non-compliant out of 100. So 50% people are non-compliant. At the Municipal Corporation Hospital in Bangalore, a study of 215 animal bite patients. One dose vaccine was administered intramuscularly on day 0, day 3, 7, 14, and 28. This also measures the constraints for compliance of the patient, and it is comparative to the study at Delhi Safdarjung. Now, this constraints for compliance to complete course of anti-rabies vaccines. There are many reasons: interference with the school timing, distance from the hospital, cost incurred on the treatment, forgetting the dates, loss of wages, loss of your daily work. These are some major compliance constraints. Next slide. The non-compliance led to evolution in treatment regime. From initially it was 31 doses, then it came to 5 doses, and now we have come back to 3 doses. The medical need introducing a novel vaccine with simple and shorter duration, the shorter regime. Novel 3-dose recombinant rabies G protein vaccine. So it is the first protein subunit vaccine prepared by VLP platform technology. First vaccine with 3 doses, intramuscular regime, 0, 3, and 7. So the treatment is finished within 7 days or 1 week. So this has got very good compliance due to the easy flow of regime and less visits, less duration, and easy application. Convenience, ready to use, no reconstitution needed. VLP technology. G protein is difficult to stabilize. So this is how the vaccine is prepared or the vaccine is made. We need not go into these details. Next slide. Safety and immunogenicity of the novel 3-dose recombinant nanoparticulate rabies G protein vaccine administered as stimulated post-exposure immunization. A randomized, comparative, controlled, and multicentric phase 3 clinical study was done to evaluate the immunogenicity and safety of the rabies G protein vaccine administered as a stimulated post-exposure immunization in healthy volunteers. Randomized, comparative, controlled, multicentric study was done. Total subjects were 800. So total it was given to 800 people. The 5-dose therapy was given to 3-dose therapy was given to 533 patients, and 5-dose therapy was given to 267 patients out of the 800 patients. The efficacy is given on these bar slides. Safety is also given on these bar slides, and you can see the green and the gray columns, which clearly indicate the difference, large differences in all the columns, and we see that the green column is better. Okay. What is the conclusion? So novel 3-dose was non-inferior to reference vaccine, less adverse effects compared to reference vaccines, and novel 3-dose was found to be a safe and immunogenic and was comparable to the 5 dose of WHO pre-qualified vaccine. So this has been awarded by Pharma Innovation of the Year by the Economic Times and also the Golden Globes Tiger Award by Malaysia for Innovative Product of the Year. Thank you. That's all. So this is a small talk. You can have your questions. I'll try to answer them as much as I can. If there are any questions.
If any question, please drop your question in drop box. I will read and sir will give the answer. Please, any question? Okay. So, sir,
This is a
quick
very good
question.
question. The 3 dose makes it highly compliable and the cost effectiveness is also there. The easy acceptability is there. Mechanism of injection is very simple. It is usually given on the deltoid, not given on the buttocks. And ideally, it should be given on the day of bite, that is day 0. It can also be given late if the patient fails to get it on the first day. Any day the patient comes, that will be treated as day 0, and then day 3 and day 7. And there are 3 types of animal bites usually. So exposure is of 3 types. The exposure number 1 is when the saliva comes in contact with the body and there is no actual damage or breakage of the skin by the animal bite. But if the patient already has a bite or an ulcer or a wound on his body and gets saliva on that, then it is highly infective. Number 2 is when there's piercing of the skin by the bite. And third is when there is deep wounds or multiple wounds. And nearer to the head, more serious or more graver it is. So a bite on the hand is more severe than the bite on the foot, and a bite on the neck or face is much more severe than the bite on hand or foot. Hello, any more questions?
Okay, sir. So, और कोई क्वेश्चन है तो प्लीज आप ड्रॉप बॉक्स में डालिए. ओके सर. सो अभी सर शायद कोई क्वेश्चन नहीं है. सो थैंक यू सो मच.
Right, so we
Dr.
conclude.
Sir, for the informative talk. We truly appreciated your efforts. Last but not the least, we would like to inform you that Travis has won the 2 prestigious awards in innovation category. First is ET India Pharma Award, and second is Golden Globe Tiger Award. So thank you very much for your participation. Thank you very much, sir.
Good day to everybody, and thank you.